wet and slippery coatings. Continuation ito last time. So we continue with the tongue pictures. O, tingnan nyo po, very pale. So masyadong maputla. And the key word here, slippery white. Thick coating. That's very, frequent bouts of diarrhea, shortness of breath, tiredness, feeling of heaviness. Ito masyado na tong very, very dampness, di ba? Inability to fall asleep. Okay? Okay, background to disease, mahilig kumain ng mga sushi, raw food, mga kinilaw, excessive physical activity. Alam niyo ba, pag excessive physical activity, nagdi-diminish din po ang chi. So there is such thing as overdoing it. Diba? So syempre, what will happen? For all you know, lalo kang nagkakasakit. Excessive use of sauna. Remember, when you use sauna too much, you sweat a lot. And so, nagiging deficient ka rin. And the sweat is related to blood, right? And of course, kasi mainit so nade-dehydrate ka. So, kaya yun. Spleen deficiency nito, ang diagnosis, because as you can see, the tongue is very pale, right? And then, long-standing, cold dampness, na nag-transform into phlegm. Okay? So it's very phlegm now. Okay, why? Because it's sticky, no? At saka a bit rough, kung nakikita nyo. Okay. So case history, Mr. P, 54, suffered bouts of diarrhea. Stools watery but not particularly smelly. So bakit ito sinabing hindi smelly? Because hindi siya damp heat. He was very tired, so very deficiency. Even though his body felt heavy, he still forced himself to exercise a great deal. No, lalo lumala. After his daily training program, he used the sauna. In order to stay fit, he chose a diet consisting mainly of salads and fruit. So meron din siyang difficulty falling asleep. So this is very blood deficiency. Pero pag nakatulog na siya, he slept well. So you have to be very, like when you ask questions like this, how is your sleep? Okay naman. But you have to be specific. Like, does it take, will it take long for them to sleep? About 2 hours, but 3 hours. Tongue was pale, slippery, thick white coating. Pulse was frail and submerged. So masyadong alalim. Excessive physical activity and consumption of raw foods. Magwi-weaken po yung TNT ng spleen. Transformation, transportation. So, ibig sabihin nagkakaroon ka ng spleen deficiency. Take note, excessive physical activity. So, fluids will accumulate and this will turn to dampness. So nag-transform. This will manifest in the loose stools, and then there is feeling of heaviness in the body. Pale tongue body with a slippery white thick coating and weak pulse of very deficiency. Inability of Mr. P to fall asleep was caused by heart blood deficiency. Due to both insufficient blood, dahil po sa spleen deficiency, and excessive sweating. Excessive sweating, because there's heat, this will injure the blood. Another case is 40-year-old female, pale tongue, swollen, slight teeth marks. I think you're very familiar with this already. Wet, white, thin coating, thin, pale yellow coating in the posterior third. Acute stomach pain, as if a stone were lying in the stomach. Nausea, depressive moods, tiredness. Western diagnosis, fibroadenoma of the left breast. Background, long-standing emotional problems, irregular eating habits. So, Chinese diagnosis, as you can see, napakalaki ng swollen ng tongue, spleen deficiency, may teeth marks, no? Accumulation of damp cold, retention of dampness in the lower burner.
Sir, question, sir.
Yes po.
Sir, Yung previous, sir, if there is retention, if there is dampness, why is the coating yellowish?
We
Which is a
usually
sign
see,
of it.
no, the coating here is at the back, posterior third. And take note, when you look at a coating, that, kasi matanda yan eh, posterior third. That's a normal, sabi nga dito, tofu. So it doesn't necessarily mean there's heat. That's why you need to really look at the color of the tongue body. So do not confuse that with heat. And usually when you have like a situation like this, kung nakikita nyo yung tip ng tongue hit in the blood, so there is a disconnect between the fire and the water. Fire is hard, so yellow din yung posterior third. So that means they do not benefit from each other. Okay? So nagkaroon siya ng disconnect. And rarely do I see kidney tongue coat, posterior third na hindi yellow. Take note, the age of the patient is still very young, 26. But because of yung kanyang diet na masyadong, no, I'm sorry, hindi pala, 40 na pala, 40. 40. Yun. It's thin, pale yellow coating.
So the
Not
thin
thick
pale yellow
coating.
coating in the posterior third is not significant in this case.
No. This speaks a lot more about the kidney. Why? Because the heart doesn't really do so much. And I think it is something the emotional problems. Okay, kung nakikita niyo may fibroadenoma na po siya sa left breast. And when you have that kind of problem, this speaks a lot about phlegm, no? Or dampness. So we cannot call this phlegm because the coating is not particularly rough, no? And ang ano kasi dito, di ba, first we need to look at the color of the tongue body. It's very pale, swollen. No, siguro things would have been different. Yung nakikita nating yellow coating, the posterior third would have been more significant if we see a thicker coating, pale yellow coating, pale yellow eh. I would like to think of this as parang ano pa, although hindi naman siya ano ba to? We cannot say there is acute with invasion, but I think this is more of like nagkaroon siya ng talagang yin, sobrang yin dahil po dito. Irregular eating habits, long-standing emotional problems. So definitely there is dampness. And take note, so accumulation of damp cold. So we are looking at very, very damp, no? So kung nakikita nyo po, retention of dampness in the lower burner. And it's not exactly heat because, di ba, we would say there is heat or damp heat if the coating was thick at the posterior third. This one is thin and it's pale. So it doesn't, if titingnan mo kaagad, hindi mo masyadong mapapansin. Although I would look at talagang nagdi-diminish na po yung essence niya. Kasi masyado na siyang, kung nakikita nyo yung parang V-shape na yung ano niya, yung kanyang, and this represents the essence actually. But again, I would
Thank you very much, sir.
Yeah, thank you po. Kaya dito natin makikita, I used to be like, I would get confused, especially if we focus so much on the coating of the tongue. So, ibig sabihin, even if it's yellow, as long as the coating is not thick and the color of the tongue body is not red, no? Or, yeah. And the coating, yeah, yon. So, kasi nakaano dito eh. Una-una, the tongue body is swollen. Can you see that? So yung pa lang is already telling us, di ba? And take note, white thin coating, but it's wet, no? So there's a lot of young deficiency. Masyado siyang cold na. So kung titingnan natin, this is very significant, long-standing emotional problems. Nakaka-affect po talaga sa too much thinking, irregular eating habits. Actually, most of the women that I see na may issues sa breast, they usually have emotional issues. So I hope everybody will look at that. No? Thank you po, Dr. Gavino. Any other question? We don't mind staying too long as bago natin, himay-himayin po natin isa-isa. Anyone else who would like to comment? So, dito natin makikita na una-una nating titingnan. Ako kasi, I would usually first look at the color of the tongue, then I would look at the coating. No? Siguro, it would have been different if the color was like red and hindi ganito po yung tongue. Okay? 40 na pala yung patient. 40 na po. And also, I failed to mention, okay. If you look at yung sen ng patient, yung shen niya is talagang, I failed to, I don't know if you agree with me. I read somewhere that one way of really looking at of determining the shen, aside from yung mukha ng pasyente, and also, yung is the tongue, the posterior third of the tongue. No? Yun. So obviously, ito yung siyempre long-standing emotional problems, you would see na medyo affected talaga siya sa emotions. Thank you po. Let's go to the next one. This one is a younger patient. Slightly pale lang po siya. So parang nag-uumpisa pa lang, swollen. Slight teeth marks. So puro slight. And red points at the tip and side. So this is very significant. You know why? Kasi nakikita natin na ang ano niya po, yung mga red points sa tip and sides. What is that telling us? Ibig sabihin, kinalaman ang weather. May kinalaman ang weather. Diba, we have learned before that if you see red points at the tip and the sides, that is still superficial. Hindi pa siya And pag yung namula na yung gitna, meron na mga dots. Internal na po siya. But if you look at this, meron na po siyang mga, shall we say, yung nag-i-invite ng pathogen because tingnan nyo naman, binges of eating sweets, overweight, ano pa? Humina yata yung signal. Walang Western diagnosis, so sadly. And then irregular eating habits. So kung nakikita nyo po, importante po talaga yung kanyang background, no? These things you have to ask, especially if you see this kind of tongue, no? Kasi they will not tell you Sometimes they really wouldn't tell you unless asked. Okay? Excessive consumption of sweets, irregular eating habits, yung mga ganon. So slight spleen deficiency, accumulation of dampness, heat in the blood. Acute invasion, damp cold transforming into damp heat. So remember, damp cold can transform into damp heat if persistent. Okay. Now let's go to the next one. 67. Ito medyo maedad naman. Female, pale, swollen yung right half ng tongue, obviously. Tingnan nyo. Slippery white thin coating. Tapos, wait lang. Cough with white thin mucus, frequent urination, Now this one, this is very common. Yung mga may notch sa tip of the tongue. Oh, let's see what this means. Okay. Let's take a look kung ano ibig sabihin nito. Oh, mahina. Dali lang po, I think. So Western diagnosis, coronary heart disease, physically overworked for many years, hardworking condition, smoked for 40 years. So good luck. So spleen and lung deficiency, dampness, obstructing the channels. Dali lang po. Mabasa yun. Any comment here? Mukhang tahimik yata ang mga people. Okay. Physically overworked for many years, hardworking conditions, smoke for 40, matanda na siya. Spleen and lung deficiency, dampness, obstructing the channels, accumulation of damp cold, heart, chi, and blood deficiency. Okay, ganito, let me tell you this. If you see a notch there, that's definitely a deficiency condition of the heart. No? So in this case, it's chi, heart chi deficiency. Okay? Of course, if you have heart chi deficiency, you will also have blood deficiency. Diba? It follows. So symptoms niya, cough with white thin mucus. The color of the mucus is kasi pag yung cough niya, yung phlegm is yellowish, then medyo siya, hindi siya that could tell us a lot about the etiology, no? Frequent urination, lack of appetite, dry mouth. So what do you think is the dry mouth here about? Hindi naman siya thirsty, dry lang yung mouth.